Hi everyone. Today we are so happy to present to you Editor's Choice article about medication underuse headache. And we're talking to the author of the article, which was published in Journal of Cephalalgia, International Headache Society Journal. And it's Dr. Rattanawong. And my first question was, uh, could you please tell us a little bit about yourself, where you located, and how did you develop this vision for this article? What is medication underuse headache?
Okay, so hello everyone, and thank you, Dr. Rickens, for inviting me to this talk. My name is Wanakorn Rattanawong. I'm currently a lecturer in neurology at Kim Mongkut Institute of Technology, Lagerbang, which is in Bangkok, Thailand. I actually graduated from Chulalongkorn University and also neurology in Chulalongkorn University as well. And I also did some research with the King's College group with Professor Peter Goadsby. That was around like a short course. And I also was mentored by Professor Alan Rappaport as well. And so for your question about the medication and the use headache, now let's see about this concept. Well, this concept actually came from the Thai Headache Society, was first coined by the Thai Headache Society. Last year, we had a campaign on medication overuse headache, which we know that is like a, a problem all around the world. But, and then one of our chief academic advisor to the Thai Headache Society came out with the comment that, so what really actually made people have medication overuse in the first place? So then the president and also the chief, the academic chief actually came to me and then, Wanakorn, why don't you like speak in the Thai Annual Neurology about this topic about medication and the use headache? There's got to be something with medication and use headache that leads to medication overuse headache. So that is where that concept was actually made up. And then so I went into research about this topic. And so when I dig into more details about this topic, I think that it's not just about using less medication that causes medication chronic migraine chronification, but we could actually separate, I mean, like in terms of this into actually four categories. First is about inadequate efficacy. If the medication you're using does not have a good efficacy, that leads to migraine chronification. Second is that improper timing. What's actually the right time to give the medication to the patient so that you prevent it from migraine progression? Third is definitely you're not using the medication at all when you're supposed to use, or you use less medication, that's the problem. And fourth is actually about the tolerability. So that is where we coined the term medication underuse.
Oh, this is excellent. How did you create a methodology? Was it literature review? Are there conversations? How did you do it?
So the literature review was actually so it's basically from the methodology was actually from literature review. So we we came when we came up with this topic, I talked to a lot of professors that how are we going to actually define the word underuse? So that is when we define. After that, I came into search, and then we search all the terms. So in the PubMed that we do, it's more of like a systematic review. We included like, for example, like the word underuse, inefficiency, inadequate, and those things. And then we came up with a list of research, which it was, I think this topic is very important, but what we see from the literature is that there's insufficient information that still lacks. And I think this is definitely for the future to study on.
So, what should we do? What should be goals of treatment to avoid migraine chronification for undertreatment?
Okay, that is actually a very good question. So In my paper, we actually separated into the two types of medication. So we know acute medication and preventive medications. Now, for the acute medication, I think there is actually a very good established papers that studied on the first is that it's the perfect timing. So what we actually know at the moment is that so there was two studies, the Aquin mouse studies and the Temple study, comparing between giving when the headache is mild, comparing when giving when the headache is actually at a well form or moderate or severe pain, or giving at it before 1 hour. Those there it shows great decrease in the 2 hours headache free. It sustains no headache for 24 hours. So I think that is actually the perfect timing. And there is also a study that did in a basic science by Professor Ramy Bernstein, actually said there was a study that he did comparing at the very first hour that was more of a peripheral side, and the signals did not go into the brain. So that is where the perfect timing is before 1 hour. So that's about acute medication, is that you have to take it fast and you have to choose the right medication for the patient. So next in the future, I think we should go to more of a migraine-specific drugs to actually help treat the patient. Now, going for the preventive side, I think that the best way is that to choose to actually, because we know that from the Overcome study, only like 17% of patients eligible for the preventions are actually taking prevention. So in the future, we should encourage more the patients to take these medications. And the second thing that I think is very necessary is that, so in the future, because we know the old preventive drugs comes with a lot of side effects, but in the future, it's more of like a migraine specific drugs, and everyone would be happy. But I know that the problem still in present day is the price. And also that is like the way in Thailand, it's very hard for Thai patients to actually get these medications. But in the future, if the price goes down, I think that would actually help a lot of patients in the future.
That raises wonderful, important topics of patient advocacy and education. This is outstanding work. Thank you so much. And I hope that our viewers and listeners will read the paper if they didn't yet, and that we're going to have many more research projects with your authorship. Thank you so much and congratulations on this amazing work.
Thank you, Dr. Rickens, for inviting me here, and thank you for everyone. Thank you.
Thank you.